Local healthcare tech business run by McMaster grad has hit just about the 1-year anniversary right now. The business is meant to improve patient care here in Canada. I want to talk a little bit about the work that's been done, the accomplishments they've made over the last year, and going forward, how this is going to benefit the healthcare system. This is kind of timely because we've been talking this week, as a matter of fact, about some of the deficiencies in the healthcare system and people falling through the cracks. And we think that what's going to happen with InnoCare is actually going to make a difference. Heather Shantora is the CEO of InnoCare, and she joins us here in studio to talk about this. Happy anniversary, first of all. You're coming up on that.
Thank you.
Good to have you with us today.
Thank you. Great. Thanks for having me.
I am always blown away by the innovation that's shown here in this community, and we've seen a real revitalization of this. Now, I know that you were involved in the political realm for a few years, not as a candidate, but working on policy for a number of different people and for cabinet ministers, for that matter, too. It's got to be heartening for you, too, to see the way that Hamilton has really almost reinvented itself, and now here you are, you become part of that change.
Mm-hmm, absolutely. I'm a proud Hamiltonian, and there is a little tech bubble happening right now, and I think McMaster has a lot to do with it, as well as the Hamilton Health Sciences. They've really invested in getting the right people into Hamilton and really nurturing the talent that's already in Hamilton and having them come forward with innovative ideas and really driving change out of our city.
Well, you look at some of the stuff that's happened in the world, and you know, that we are just, wow, isn't that amazing? For instance, robotic operating that can happen right now, and that was developed in Hamilton. I mean, there's a lot of stuff that's going on here. And that might have been maybe the brightest and the best, and one of the great ideas I mentioned on my blog earlier today, but honoring Peter George. They just named a new building after McMac. And a lot of that innovation and drive started when Peter was the president of McMaster, and maybe one of the best ideas was, of course, that collaboration between McMaster and Hamilton Health Sciences. It's really created a research and development hub here, hasn't it?
Mm-hmm. It has. He was actually president when I went to McMaster, and I certainly was part of that movement. And really the investment they put into engineering and medical, like really forward-thinking investments to make sure that our city prospered by really fostering kind of innovation and you know, forward-thinking sectors. And I think healthcare is now becoming one of those forward-thinking sectors.
Well, we've seen this. It's not like you can just say, we want to be a tech center. You know, no, somebody's already doing that. Well, we want to be like KW, as you know, with BlackBerry. Well, you can't, because they're already doing that. So you have to find something that you're good at, and healthcare has been something that we, I think, have been growing here in the last number of years, and we've pretty much been on the leading edge when it comes to innovation here and collaboration. You know, the collaboration between St. Joe's Healthcare and Hamilton Health Sciences. I know there are some jurisdictions where that just doesn't happen, where they're not quite competing with each other, but they're not working as closely together as they could. We've developed a real sense of cooperation and coordination here, haven't we? Absolutely.
And the neat thing too is that those two major hospitals are now actually including the private sector. So the companies that we provide the software to are outside the OHIP sector. So it's physiotherapy, chiropractic, massage, etc. And we have a ton of data and analytics. And of course, the patients cross from the hospital setting into outpatient care and clinic settings. So now that there's more communication between the two, we can give seamless patient care and better outcomes for Canadians.
Let's talk about how you started this business, the germ for this idea, and how you decided to put this whole thing together. Let's go back about a year and a half or so.
So I was actually part of running one of the largest chains of physiotherapy clinics in Canada, and we had created all this great technology and software and services to support that business. But what we noticed is 90% of the marketplace is independent clinics, and those independent clinics couldn't compete on scale that the larger chains could. And so what we did is we created InnoCare last April and brought it to market. So we would supply the software, the services to the independent clinic marketplace, allowing them to have an edge and allowing them to be able to compete with the larger corporations and to be able to service patients efficiently and collect data and records and things that when you're an independent silo you can't do. So back to your point about collaboration, it's really allowing them to become part of this network through InnoCare, where they then can share the technology, share ideas, and really push their practice forward.
So they're all independent operators, but they're working under the same umbrella then, with your help.
Correct, yes. So we work as a group, whether it's competing for preferred provider contracts to deliver physiotherapy care. Everyone also is on the same software platform, the same charting, so that data can be, rolled up so we can look at trends, for example, in healthcare, and those are the types of conversations that we can then go back to academia or to hospitals to say, listen, we're noticing this trend. How can we work together on this?
Here's why this is such a great advantage, and I know you know this because you talk to the operators on a consistent basis. It's paperwork that you're basically taking away from them. And so, they want to run the clinic. They want to be able to have literally hands-on, obviously, in a physiotherapy clinic, for instance. And this is a bother to them. And for you to develop a program that basically says, don't worry, we got your back here. This is going to make the administrative part of your job a lot easier. Mm-hmm. That gives them more time and probably a better comfort level with doing the other element of the job, which is the physiotherapy in the first place.
Absolutely. And that's what they went to school to do, and that's where their passion is, really taking care of patients.
You talk to any businessman, I hate doing the GST stuff. I hate doing they just want to do what they do best, and you're allowing them to do that.
Absolutely. And so our software, for example, they would just take a chart note on a patient as they usually would, but that chart note now will populate the workers' compensation forms or the motor vehicle accident forms. Before, that would have been hours of paperwork a week for them to fill this out. Now that it's auto-populating and all these things are transferring across, they can actually spend more time on patient care. And the reason this is important is when we look at wait times and other things that are ballooning in the healthcare system, the more efficient we can make the clinicians, in other words, the more paperwork we can take off them, that allows more hours every week to treat patients. That then brings the wait list down. And really that's what we want as a healthcare sector, is to treat more Canadians and to get them better faster. So we want to leverage technology to help that happen.
So talk to us a little bit about the program itself, and I'm sure that a lot of the people listening to us right now have gone through this at one stage or another. Physiotherapy. I mean, let's face it, we're doing a lot more joint replacements than we ever have. Yes. Lots of surgeries. We're living longer and aching more. So we go to these clinics. So everybody probably in their mind is picturing, I had to wait 20 minutes. I was supposed to be there at 1 o'clock, but and the person supposed to be helping me was sitting there at their desk doing paperwork. You alleviate that. You take that element out.
Right, we do. So we do everything from scheduling the patient in our software all the way through to billing the insurance company on behalf of the patient, so that the patient doesn't need to pay out of pocket. And by being able to, for example, bill through our direct integration, it means that we can do less paperwork. There's less onus on the patient to then, pay that bill and then take it away and pay and submit. And so we're alleviating paperwork on the front desk staff, on the clinical staff, as well as on the patient, so they have a better experience. But to your point, it actually speeds the whole process up. One of the other things we do in these charts is there's increased pressure on clinicians to fill out more paperwork because of increased privacy law as well as regulatory requirement. And while those are good things and protections for patients, it has created more time that's required doing indirect clinical care, so in other words, paperwork. By us being able to use technology as a backbone to speed up that whole process, we actually avoid patients waiting in waiting rooms. We also can do things like smart wait lists and booking online. And, really technology is such an easy tool that has been applied to every sector, but very late to the game in healthcare. And that's where InnoCare comes in, is we're bringing technology to be the backbone in a clinic to allow them to deliver better patient care faster.
But what I like about the program that you've developed here is, like you say, this is all-encompassing. This is actually good for the patient as well. Mm-hmm. It was a pain in the butt if you had to go and pay cash for something and then said, okay, fill this out, send this to your insurance company, you'll get your money back. Well, no, I don't want to do that. You've almost eliminated that stuff right now. You're doing the work for everybody.
Correct, that's right. And we were one of the first companies to build an integration for the employee health benefits to do that. And it is a pain for the patients, and in some case they forget
it's a hardship
the
for
paperwork. Yeah, and then they don't get reimbursed.
I don't have the $120 right now.
Exactly. So we have a billing integration for the employee health benefits as well as workers' compensation, OHIP, and then motor vehicle claims as well. So in all those categories, the patients just, check out at the front desk on their way out. They're required to leave some signatures and things, but that's it. They don't necessarily have to dip into their pocket as long as everything's covered, which is great.
How do you devise and coordinate a system like this? I mean, there's so many different elements here that you've had to bring together.
It's a really great team of very forward-thinking individuals, again, based in Hamilton, which is really exciting. We're actually tucked right behind the Hamilton Spectator building. We have 90 really great individuals who all are quite progressive in their thinking. They are very young. It's a young team who's really thinking about how to apply technology to make the business better. And because we've spent so much time thinking about it, the strategies in place, it was really just building the things to have it come to fruition. And, it's so gratifying to see this actually being deployed across Canada and making the difference that we hoped it would.
But you've got this idea, and okay, hey, this is fabulous. But now you've got to bring all these agencies together around to this, too. I mean, everybody has to buy into this, right?
Yes. A lot of their technology exists, and so it's really a matter of creating the APIs that will communicate with it. That's a big investment of development time, and other companies haven't wanted to spend that investment because we saw the importance of it to the patients and to the clinicians and to the front desk. We actually invested up front heavily in developing those things, and I think the investment was worth it.
Well, because there are benefits then. I mean, whether you're talking about WCB or anybody else, I mean, you're making their job easier now, too.
That's right. And by being able to improve the data integrity of the paperwork, so in other words, when you have to double enter it, for example, errors are likely to occur. By being able to take the data right out of the system and send it right to workers' comp, there's minimal chance for error, which makes their life easier. It's more seamless. The payment comes in faster. This claimant is returned to work faster. It's a win for everyone.
How's the last year been?
Great. Really growth beyond what we expected, but in a really exciting way. And I think the thing that's most meaningful to us is the feedback that we're getting from clinicians saying, this really was a game changer in my practice. That's really what we're in this for, and that's been the most rewarding.
How do you get the word out? You've got all this coordination. You've done the program. You've got these brilliant people working with you now to get this thing going. But it doesn't work unless you get people, the clinicians themselves, to buy into this and say, yeah, that's something I could use.
Yeah, absolutely. So we try to meet as many clinicians as possible through association events and regulatory events, but also opportunities like speaking with you today, really so that we can begin to kind of permeate the healthcare sector and make our message heard so that they're able to be part of this.
There was a debate. I don't want you to get into the politics of this right now, but about e-health and whether that was a waste of time, et cetera. And there were certainly some problems and some administrative and some financial problems to do with that. But it's so critically important to develop an electronic opportunity here for the delivery of health care, basically, from a coordination standpoint, for the sake of everybody involved in this. I mean, what you guys are doing right now is really cutting edge and something that the industry, I think the healthcare industry right now really needed.
I think it's dangerous not to. We all now, to your point, because we are aging Canadians, we're seeking care from so many different places, the pharmacist, the doctor, the physiotherapist. If all of these clinicians aren't speaking together about our care, there's a risk that we could be doing things that are that are contraindicated, right? And they'll hurt each other. So being able to have these systems communicate, I think, is absolutely critical to making sure our Canadians stay healthy. And we know that the more that it communicates, the Canadians get healthy faster, and I think that's really important, and it helps the budget. So the upfront investment is great because it will help our overall budget in the end.
Well, sure, and if, for instance, you go to a physiotherapy session, to use your example, wouldn't it be great to know that the person who's giving the care there has your medical records there? They can understand, you wait a second, you're taking this medication? That's going to impact the way we're going to treat you. I mean, that may be something that I, as a patient, might forget to tell them.
Right, and often they do, or the things that a patient wouldn't think are important actually sometimes can be incredibly important. One of the things we've built into our charting software is a mechanism for the assessment notes as well as progress and discharge notes to be able to go back to the family physician, so that the family physician has a complete record of what you've been doing at physiotherapy, so that when you go in, you don't need to remember everything. That's in their file for them.
So you're the ones when they say go, they say then you get back to your family doctor a couple of weeks later and you just hit the button on the computer and everything's there. That's that kind of coordination. He doesn't have to say how's the physiotherapy going. He already knows.
Exactly. Yeah, and it has taken some workarounds to be able to do that. We haven't been able to integrate with all the physician electronic medical records yet, but what we've done is actually we just send it to them via a secure method, and their front desk upload it into the chart. So there are workarounds that I that I think that all participants in the healthcare sector need to be thinking about, because the end goal is getting that patient better. So let's work on ways to make that happen.
It's got to be gratifying, though, to see the way this company has grown in the last year, though. And the potential, I guess, for the future. What do you see happening in the next couple of years with what you specifically do with InnoCare?
Right. So on InnoCare software, we have over 1,200 clinicians now. We're in every province, which is fantastic. We're on track to double our software sales in 2017, which is great. I think that one of the things, though, that's really exciting is the fact that this will stay a Hamilton company, and we will continue to grow and thrive in Hamilton. And the developers, all the technical team, everyone works at a Hamilton, and I think it's really important that we stay focused on where we're from as well. And we have a benefit too in that Hamilton's a great place in terms of hiring resources and economic benefits of working in Hamilton, because it is a cheaper job market than GTA, for example. That I think it actually gives us an edge, the fact that we're from Hamilton. It's an edge over our competitors.
What about workforce? Do you have? Are we training people to do this kind of work? I mean, are we feeding the system so that as you continue to grow, and we want you to continue to grow, that you're going to be able to find qualified people to fill those positions?
Yes, McMaster is fantastic in terms of their graduates, and Mohawk as well. Mohawk has a lot of really creative programs now that are really focused on innovation, and so the grads that are coming out of there have really unique skills, and it's been a great benefit to our company.
There's another one of those collaborations. We talking about everything else. We forgot about the educational aspect, the cooperation between Mohawk and McMaster these days at the Innovation Park and so many other places, and obviously in the medical field with research and development too. There's a lot of teamwork that's going on here in this community. It's got to be a lot of fun to be part of that, and you seem to me the sort of person that gets a real rush out of just going to work every day.
Yes, absolutely. Which is the best part of it, right? When it's not work, when it's fun. I think that's when creative ideas and innovative things happen, is because your passion's in it. It's your passion. It's not your job.
Yeah. Well, it's working and it's growing, and that's fabulous news. Congratulations, Heather. Again, happy anniversary, and nothing but good things for you and for everybody at InnoCare. This is a great idea. And clearly a lot of people are starting to buy into it as well, too. So I wish you all the best in the future. Thanks for coming today.
Thank you so much for having me, Bill.